Hi, I'm Lauren Meffin, speech pathologist and certified lymphedema therapist. So today we are going to discuss the differences between over-the-counter compression and utilizing and determining which one am I supposed to use for my head and neck lymphedema. Now, there's two types to select from when you're going to go on Amazon and click in bandages, compression bandages. So your first is going to be your short stretch bandage, okay? Now, most of your lymphedema therapists, when you go to see them, they are going to have a variety of short stretch bandages in different widths to determine which is the most appropriate for you. The elastic bandages, also known as long stretch bandages, are not utilized in lymphedema therapy. Okay, so the most important thing to know is these elastic bandages, these are going to stretch and not serve a purpose as your edema increases or swells. Okay, these short stretch bandages, I'm going to stretch a smidge, but not much. Okay, now if you come to my office and see me, most of the time, my bandages are not perfectly rolled. Your other lymphedema therapist might be slightly more organized than this one, not me. So we have now determined that we need a high working pressure, okay? And that is necessary to help with mobilization of lymphatic fluid and lymphatic pump during compression. So absolutely no ifs, ands, or buts about it. We are not utilizing an elastic compression. Number one rule, okay? So here we go. Now I'm going to teach you a little bit of how in the world would I roll my head and neck to compress with this bandage. Well, I am going to first place my Pure Night submandibular chip pack underneath my chin, okay? This is super tricky, so I need 4 hands, or really 8, all right? Now I'm gonna leave myself a little bit of rhythm and room. As I go, I'm gonna pull up, and I'm gonna go like this, all right? I wanna be tight. I don't wanna be like, can't breathe tight, but I want it pretty stinking tight. Now I'm going to roll my compression here. For me, when the patients leave the office, they are either if they come in with submandibular lymphedema or submental lymphedema, they are in a short stretch bandage, or we are determining what's the next step, whether we need a custom or an over-the-counter garment. Okay. Now, I've got myself wrapped. You saw I just tucked that in. I really, if I wanted to, I could tape it. And honestly, if I was going to walk around with this all day and all morning at home, I would tape this. So here's a couple of rules I need you to make sure. I don't want you like this. We cannot have chipmunk teeth. We cannot have chipmunk cheeks. Okay. I don't want you swelling at the lips. Okay. Ideally, you're going to utilize this compression for around 3 hours a day. So this compression might be utilized in a patient who's undergone radiation and is 3, 6, 12 months out from radiation that potentially involves both sides of the jaw lines underneath. Okay. Now, what I placed under my short stretch today is something that is not over the counter. This is ordered through one of the companies that we work with. But if my patient has a different type of lymphedema in which it only involves one side of the jaw, or underneath, under the chin, this is not going to be my first choice. However, if they have both sides, this is super soft, super breathable, And I have found that I really gain compliance with it. So, a couple of reminder important tips today. Most importantly, a short stretch bandage is indicated for lymphedema of the head and neck. An elastic bandage is not. No elastic bandage, okay? That's super important. You can utilize this over the counter while you're waiting and determining what are your next steps with your lymphatic therapist or your lymphedema therapist on a kind of an improved overall compression plan. So perhaps you're ordering a custom garment. Perhaps you are waiting for an over-the-counter that is a little bit more user-friendly. But for anywhere from $4 to $7, sometimes on a different week, maybe I spend 11, this is a very nice option, okay? So a couple of things I want you to remember. Compression is an essential part of the complete decongestive therapy. We call it CDT. You have to have compression. You cannot only complete manual lymph drainage, or some people get grouchy, it's not massage. We'll call it your non-massage. So you have to utilize compression. The longer you utilize your compression and the more effective that it is, the better your lymphedema is going to be managed, okay? We recommend a minimum of 3 hours a day. That's really important. So if you have any questions or if you have suggestions of how can we help make this a little bit more valuable for you, please feel free to comment, share with me, hey, Lauren, I want to know about this. What do you think of this type of compression? Let's get the conversation going, because every patient will be different based on the type of treatment they had, based on if there were any surgical removal of lymph nodes, based on the radiation, timing. All of these factors play a key role. Skin integrity, that's huge. If the skin is not healed and cannot tolerate compression, you're not here yet, okay? Step one is skin integrity, right? Allowing the skin to be able to accept something touching it without hurting it. That is really important. Okay, feel free to comment. Also download our guide. That are some useful tips for products that may help with managing your lymphedema. I hope you have a wonderful rest of your day.